Good day, Masilog Zambales. Good day to our beloved learners from grade 9. You are now listening to Serbian Putog Radio, DWSP 101.5 News FM. This is your on-air teacher, Teacher Jojit M. Elemento, always at the service for the Filipino learners. Yours truly is from Bambana National High School. I will facilitate you in maximizing your participation as you will learn today's lesson. Welcome mga kamapimilya. Our topic is all about prevention and management of environmental health issues, the COVID-19. I will guide you in the first quarter of Wk6 module. Are you all ready, students, to embark on the journey toward learning MAPEH Health via radio? At this moment, please get your self-learning module prepared by the development team of the module headed by Lalaine M. Maagad from the Department of Education, Division of Iligan City. Distributed by your respective school for our topic today. You can also get your notebook and ballpen to take down notes about the lesson that I am going to discuss. What this module is about. People would like to live a comfortable life free from all kinds of adversities and complexities. In nature, humans cannot live alone. As what they say, no man is an island. We and other living things on our environment need and depend on each other in some way or the other, like food, shelter, and other necessities in order to survive. In the same way, we also affect one another either positively or negatively. These interactions affect quality of life, years of healthy life lived, and health disparities. The World Health Organization defines environment as it relates to health as all the physical, chemical, and biological factors external to a person and all the related behaviors. The interactions between the environment and people's health raise complex ethical issues related to environmental regulations and health policy decisions. To cite an example is the occurrence of COVID-19. Through this module, you will learn more about the coronavirus disease and its origin, how contagious it is, its symptoms, how can it be treated, and what preventive measures can we do in order to help the government in the prevention and control of COVID-19. Maintaining a healthy environment consists of preventing or controlling disease, injury, and disability related to the interactions between people and their environment. It is important to increasing quality of life and years of healthy life. As a learner, you possess a significant role to the environment. Your knowledge and cooperation will serve as a groundwork for others to initiate desirable health attitudes, pro-environment habits, and practices for a healthy environment. At the end of this module, you should be able to suggest ways to prevent and manage environmental health issues. First, I want to test your prior knowledge regarding the environmental issues nowadays. Get your pen and paper and number it from 1 to 5. This is a multiple choice type of test. I will read each of the following statement and choose the best answer. Write the letter of your choice. Number 1. The best way to protect yourself and others from COVID-19: A. Washing hands with soap and water. B. Applying alcohol to hands after holding surfaces. C. Wearing of face mask. D. All of this. I'll give you 5 seconds to answer. Correct! It's letter D, all of this. Number 2. How does the wearing of face masks help prevent COVID-19 transmission? A. It protects us from droplets of saliva through talking, coughing, and sneezing. B. It protects us from dust and smoke. C. It hides our pimples from dirt. D. It prevents entry of dust to the nasal tube. I'll give you 5 seconds to answer. If your answer is letter A, you are correct. Very good. Now, let's proceed with number 3. What should you do to prevent or slow down the transmission of COVID-19? A. Observe at least 1 meter distant from the other people. B. Observe at least 3 meters distance from other people. C. Observe at least 5 meters distance from other people. And D. Observe at least 10 meters distance from other people. Again, you have 5 seconds to answer. If your answer is letter A, you are correct. Observe at least 1 meter distance from other people. Very good. Now, let's have the number 4. What should you do if you already felt difficulty in breathing or pain, pressure in the chest? A. Seek assistance from a person who has already received treatment of COVID-19. B. Consult interagency task force. C. Seek immediate medical care. And D. Stay at home. Again, you have 5 seconds to think. If your answer is letter C, you are correct. Seek immediate medical care. And now, for the last and final question. Number 5. What should not be done to prevent and control the spread of COVID-19? A. Social distancing of at least 1 meter away from other people. B. Wearing of face masks. C. Group gathering or crowding. D. Stay at home. Again, you have 5 seconds to answer. If your answer is letter C, you are correct. Group gathering or crowding. How's your score? Did you answer it all correctly? Very good! And now let's proceed with our discussion. COVID-19 is the greatest global shock in decades. We need to protect ourselves and to recover as quickly as possible. However, we cannot easily go back to the way we did things before, and yet we are trying to cope with the so-called new normal. The new normal has completely changed our lives in several different ways. Despite all of this, the COVID-19 crisis we are currently facing has indeed shown that we are willing to support and abide even difficult policies and adjust with the new norms and government protocols with a clear aim of protecting our health, our families, and our livelihoods. Irrelevant to this, the modules give you learners the knowledge about the most important details and relevant issues related to the coronavirus disease. It provides the preventive measures and safety tips on the prevention and control of the spread of the disease. It will also guide you on the things that should be done and not should be done during the new normal. Now, I will give you an activity. Below are pictures that can either prevent environmental health issues or destroy our environment. Pick the numbers of the pictures which can prevent environmental health issues. Let's proceed. Number 1, picture shows use of aerosol sprays. The number 2 picture shows use paper bag instead of plastic bag. The number 3 picture, ride smoke belching vehicles. Number 4 picture, wasting of water. Number 5 picture, tree planting. Number 6 picture, reduce, reuse, and recycle. Number 7 picture, bicycle riding. Number 8 picture, cigarette smoking. And number 9 picture, proper waste disposal and segregation. So I will give you 10 seconds to pick your answer. And now, let's check your answer. The following pictures that can prevent environmental health issues are the following. If your answer is number 2, use paper bag instead of plastic bag, you are correct. Next answer is number 5, tree planting. And number 6, reduce, reuse, and recycle. And another answer is number 9, proper waste disposal and segregation. Very good! We have learned from the previous module that quality of life depends on the condition of the environment in which we are dwelling. And this has been proven true since the outbreak of coronavirus disease began. The spread of the disease had brought anxiety to millions of people in our country and worldwide.
Mahigit 2,000 ulit ang mga naitalang bagong kaso ng COVID-19 sa bansa ngayong araw. 2,298 po yan, kaya umabot na sa 385,400 ang mga tinamaan ng COVID-19. Pero kapansin-pansing malaki ang ibinaba ng mga aktibong kaso o yung mga hindi pa gumagaling. Nasa 29,301 na po mula sa mahigit 41,000 noong Biyernes. 82.5% ang mild cases, 9.6% ang asymptomatic, tumaas naman sa 5% ang critical, habang 2.8% ang severe. Benguet ang nakapagtala ng pinakamaraming bagong kaso ngayong araw. Sunundan po ito ng Davao City, Rizal, Quezon City at Bulacan. Sa bilang naman ng mga gumaling, 87 ang nadagdag ngayong araw, kaya 348,830 na po ang lahat ng nakarecover. 7,269 ang mga nasawi sa COVID-19 matapos madagdagan ng 32 ngayong araw.
What is a coronavirus disease?
Ano ang coronavirus? Ang coronavirus ay isang uri ng virus na nagdudulot ng respiratory illness sa mga hayop at tao. Unang natuklasan noong 1960s, Tinawag itong coronavirus dahil sa malakorona nitong hugis. Sa kasalukuyan, may 7 klase ng coronavirus. Kabilang na ang mga malalang kaso nito na Middle East Respiratory Syndrome o MERS-CoV na unang naitala sa Saudi Arabia noong September 2012. Mula ito sa mga camels at isa ring uri ng coronavirus na may flu-like symptoms. Nasa 858 confirmed cases nito ay nauwi sa pagkamatay. Isa pa sa deadly coronavirus ay ang Severe Acute Respiratory Syndrome o SARS na nagmula rin sa China. Ang coronavirus na ito ay nanggaling sa civet cat at nagkaroon ng 8,000 kaso at pumatay sa humigit kumulang 800 na tao. Ang bagong strain ng coronavirus na nagsimula rin sa China ay tinawag na ngayong coronavirus disease o COVID-19. Tulad ng MERS-CoV at SARS, ang COVID-19 ay nakamamatay. Sa oras na ma-infect ang isang tao, mabilis itong kumakalat sa lower respiratory tract, kabilang na ang baga. Ang coronavirus na ito ay maaaring magdulot ng malalang pneumonia sa loob lamang ng ilang araw. At hindi ito kayang gamutin ng kahit anong antibiotic. May mga kaso ng coronavirus disease na asymptomatic o walang sintomas. Tinatayang hanggang 14 na araw ang incubation period bago lumabas ang sintomas ng sakit. Ika-9 ng Enero ngayong taon nang naiulat ang outbreak ng pneumonia sa syudad ng Wuhan sa China. Ito ang hudyat sa pagkakadiskubre ng coronavirus disease.
COVID-19 is spread through human-to-human transmission. How? Let's watch this.
Paano naipapasa ang coronavirus disease 2019? Naipapasa ang sakit sa pamamagitan ng direct contact at paglanghap ng droplets mula sa bumahing o umubo na taong may sakit. Pwedeng tumalsik ang droplets mula 3 hanggang 6 na talampakan. Posibleng makuha ang virus kapag nahawakan ng droplets pagkatapos ay hahawak sa mata o ilong. Kahit wala pang sintomas, pwede nang mapasa ang sakit. Kaya mahalaga ang kalinisan at kaalaman para maiwasan ang sakit.
How about its symptoms? Let's know them.
Mga sintomas ng impeksyon dulot ng coronavirus disease. Mapanganib at maaaring magdulot ng impeksyon ang coronavirus disease. Naipapasa ito sa pamamagitan ng direct contact sa mga hayop at mga taong may naturang virus. Ang mga taong apektado ng COVID-19 ay maaaring makaramdam ng mga sumusunod: lagnat, ubo, sipon at hirap sa paghinga. Ang mga sintomas na ito ay maaaring mauwi sa pneumonia makalipas lamang ng ilang araw. Kaya agad kumonsulta sa doktor.
Regarding the treatment of COVID-19, there are still no vaccine or medicines that have been shown to prevent or cure the disease. Although, there were already several cases of people who got recovered from COVID-19, but most of these cases have only very mild symptoms and were only able to recover through self-isolation and utmost supportive care without even needing any hospital treatment, while people with severe symptoms need to be cared for in the hospital. In hospitals, physicians will sometimes use antibiotics to prevent or treat secondary bacterial infections, since some people who become ill with COVID-19 can also develop a bacterial infection as a complication. In this case, antibiotics may be recommended by a healthcare provider, but still, antibiotics do not work against viruses. They only work on bacterial infections. Hence, antibiotics should not be used as a means of prevention or treatment, since COVID-19 is caused by a virus and not by bacteria. However, the World Health Organization is still coordinating efforts with scientists around the world for an intense research to develop vaccines and medicines to prevent and treat COVID-19. There are also several ongoing clinical trials of both Western and traditional medicines. There are preventive measures or safety tips to be considered. Regularly and thoroughly wash your hands with soap and water. In the absence of soap and water, clean your hands with an alcohol-based hand rub. In this way, it kills viruses and may be on your hands. Maintain at least 1 meter distance between yourself and others in order to protect yourself when someone coughs, sneezes, or speaks. They may spray small liquid droplets from their nose or mouth, which may contain virus. And if you are too close, you can breathe in the droplets, including the coronavirus if the person has become infected. Maintaining a physical distance from everyone is a good idea, especially when you are in an area where COVID-19 is circulating. Stay updated with the latest information about COVID-19 outbreak, available on the WHO website and through your national and local public health authority and other reliable sources. Avoid going to crowded places or any mass or group gathering, since it is very difficult to maintain physical distance of 1 meter. And most importantly, in order not to have a close contact with someone who could possibly have COVID-19. Avoid touching your eyes, nose, and mouth since your hands touch many surfaces and can pick up viruses. Once contaminated, hands can easily transfer the virus to your eyes, nose, or mouth, through which the virus can enter your body and infect you. Follow good respiratory hygiene. Cover your mouth and nose with tissue or with your bent elbow when you cough or sneeze. Dispose immediately the used tissue and wash your hands with soap and water. Clean and disinfect. You can clean first with soap and water, but disinfect surfaces you touch often, like tables, doorknobs, light switches, toilets, faucets, and sinks. Use a mix of household bleach and water or a household cleaner. Wear gloves when you clean and throw them away when you're done. Stay at home and avoid going out if unnecessary. Always wear a face mask when leaving your house. Avoiding contact with others will protect you from possible COVID-19 and other viruses. Refrain from smoking and other activities that weaken the lungs. Boost your immune system through eating nutritious foods like fruits and vegetables so that we will not be easily infected by the coronavirus. In case you feel serious symptoms related to COVID-19, seek for immediate medical attention, but call by telephone in advance if possible. And follow the directions of your local health authority. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help prevent the spread of viruses and other infections. In addition to practicing the prevention tips that I have mentioned, you can also consider the following. Ask for medical assistance on what to do if you have people at your home with a higher risk. Talk to your neighbors about emergency planning through social media. Join your neighborhood chat group or website to stay in touch. Find community aid organizations that can help with healthcare, food delivery, and other supplies. Make an emergency contact list. Include family, friends, neighbors, carpool drivers, doctors, teachers, employers, and the local health department. Choose a room in your house where you can keep someone who's sick in your family or who's been possibly exposed to coronavirus. Separate them from the rest of the family to avoid spreading. Set yourself up to work from home if your office is closed. Reach out friends or family if you live alone. Make plans for them to check on you by phone, email, or video chat. If you have questions, just message your MAPEH teachers through text, call, or via messenger in your GC. I am sure they could help you. I know you can do it, learners. God bless in answering your learning activity sheets. Once again, this is your radio teacher, Teacher Jodit M. Elemento of Bamban National High School. Goodbye, everyone!